Rush University is now conducting a long-term study focusing on older Latinos and Alzheimer's. Dr. David Marquez is one of the study's co-founders.
We are trying to follow people over time to see when they do pass away, what are the factors that influence if somebody did develop Alzheimer's disease.
And up with one of the developers of the Mind Diet, nutritional epidemiologist Martha Claire Morris. She explained how the nutrients in some of these foods are making an impact.
The Mind Diet focuses on foods and nutrients that all of this research over the last 20 years has shown to protect the brain against Alzheimer's disease.
This device acts like a cork, plugging up an area in the heart that is responsible for 90% of blood clots in people with atrial fibrillation. It's called the Watchman.
So what this does is two things. It relieves the risk of bleeding, but allows us to preserve the protection from stroke that we would have gotten with blood thinners.
It is being called a game changer, a newly approved drug to treat MS. Rush University Medical Center is the first hospital in Illinois to offer that treatment, and it could provide hope for patients suffering from the devastating disease.
Once the person started on Acrobus, then they have 90% less, 90+% less in the way of new lesions, meaning the disease is pretty much brought to a halt.
Arthritis in her right knee left it swollen like a golf ball. Cortisone injections, physical therapy, medications, nothing worked.
I thought I was going to limp for the rest of my life.
Now, a new treatment, just approved by the FDA, could be a game changer for people like Felicia, who suffer from debilitating knee arthritis but aren't ready for surgery. It's called CoolLeaf. Doctors insert specialized needles that emit radio frequency into the knee, which then freezes the nerves to stop the pain. This procedure is not getting rid of the arthritis, it's taking care of the pain.
That is correct. So we're not changing the structure of the knee, but if we can get rid of the pain, she can be more functional.
Rush University Medical Center neurosurgeon Dr. Richard Fessler has devoted his career to helping patients with spinal cord injuries.
The exciting thing is, this is the first time in history.
These are embryonic stem cells being injected directly into the site of injury in the neck. The special cells produce myelin, the protective sheath that helps nerves function normally. But when a spinal cord is injured, typically crushed in a traumatic accident, function is lost.
During the last quarter, there were more than 7,000 stories that included Rush in television, radio, newspapers, magazines, social media, and on websites across the world. Rush earns more news media coverage than any other Chicago area academic medical center. Last quarter, Rush generated and distributed more than 20 original news and feature stories based on clinical innovation, education, research, and community endeavors. Rush's social media presence continues to grow, with over 1,500 social media messages sent in the last quarter, and nearly 19,000 likes and reactions received. Our video views on Facebook and YouTube numbered around 250,000. Our most popular Facebook post publicized Rush's U.S. News Best Hospitals rankings. Our most watched video was about minimally invasive spine surgery.